Hello dear fighters, this is Dr. Riaz with another episode of Be Smart Fight Strong series of videos, and today I will be talking about what are the tips and tricks that you can use to decrease the risk of nausea and vomiting. So be sure to watch my other videos which are related to this topic. In another video I talked about the different medicines that you can take to decrease the risk of nausea and vomiting, and in a separate video I talked about what are the foods you can take to decrease your nausea and vomiting. So all those videos are available on my online video library, www.onlineoncology.com. So the number one tip that I would like to give it to you is that the timing of the medicine is very important to control the nausea and vomiting. Now, typically what happens is that when people are going through chemotherapies, there is a pattern of nausea and vomiting. For some people, they feel the nausea on the first day, some on the second, some on the third day, and some have constant nausea throughout their journey. Typically what the doctors do is that the day they give the chemotherapy, they give you a lot of pre-medications before administration of chemotherapy. So be sure to know all those medicines that you are getting. Make sure that you are getting at least two different kinds of Antiemetic, which is the anti-nausea medicine. There are short-acting nausea medicines, there are long-acting nausea medicine. Nausea is striking on the first day, then a short-acting will help more. Where if it is constant, then maybe a long-acting will help more, and you can still use the short-acting while you have taken the long-acting medicines. The timing the medicine is very important. What I tell my patients is that during the first few days after chemotherapy, there is a reason for you to have nausea, and that is the chemotherapy. Therefore, take a proactive approach, meaning that with the slightest hint of nausea, just take the medicine. Don't get into the guessing game. In that period, you can overdo a little bit, that is fine, but if you're gonna underdo, then guess what, the nausea and vomiting gonna kick in. Then it leads to a vicious cycle where you won't be able to catch a break. Therefore, a proactive approach is good. Another tip that you can use is that during that time when you think that the nausea and vomiting gonna strike you, it is okay to pre-medicate yourself before eating a meal. So like about 20 minutes before starting your meal, you can take the medicine and give it 20 minutes so that it kicks in your system, and after that you can eat, and there is a good probability that you will be able to keep your food down. Then the next tip I want to share with you is that empty stomach can sometimes trigger nausea and vomiting. Therefore, you need to not let your stomach go empty and eat a little bit of something, maybe some crackers, some light snack, and eating something a lot of times helps the patient to control nausea over keep letting your stomach go empty. The next tip that I want to share with you is that if you are struggling with the nausea and vomiting, you need to have more than one type of antiemetic drugs, which are the anti-nausea drugs. Different drugs have different mechanisms of action, so they work differently. Therefore, if you are not responding good to one type, there is a chance that you may respond better to another type. Therefore, if your doctor has tried a medicine on you and you think it's not been working good, ask for different types of antiemetic drug. There are several different types of drugs that your doctor can use. Therefore, there are several options, so be mindful of that to discuss it with your doctor. Another very important trigger for the nausea and vomiting is the anxiety, and you have to try everything you can to keep your anxiety level down. Now, fear and anxiety is very common in cancer, and it is very understandable. It's natural, but There are several tips and tricks that you can use to keep your stress and anxiety level down. So be sure to watch my video in which I have talked about a lot of tips and tricks that you can use to keep your stress and anxiety level down. Whatever your best technique is, whether it's some relaxation technique or whether it's some medicine to keep the anxiety down, whatever you have to try, make sure that your anxiety level is not through the roof, because anxiety is known to trigger the nausea and vomiting in a lot of patients. The next trick that I want to share with you is that while you are fighting the cancer and while you are getting chemotherapies, and especially on the days when the nausea and vomiting strikes you the hardest, is take your meals in tiny portions. So eat more frequently in little portions. So instead of eating 3 meals a day, you may want to eat like 6 times a day. So at a certain time you are eating a smaller quantity, but you are eating more frequently. So this trick seems to help. In that way, you're not going to overburden your digestive system with too much food to process at one time, and hopefully this trick will help easing up the burden on your digestive system. Hydration has so many benefits, and I have made a whole video. Dehydration is very common in cancer patients, and it can sneak up on you, and you might be dehydrated without even realizing it. So it's a very important topic. So I will highly recommend watching that video on dehydration. So to prevent dehydration, keep sipping on water or some other drink. Now be mindful that teas, coffee, sodas, they don't count towards hydration. Simple water or sports drinks, or if you want to drink some flavored water, that also is okay. Every day you set a target that you have to achieve. Don't be very subjective about it, be objective. In a lot of patients who have no heart or kidney problems, I tell them that they need to consume at least 6 to 8 bottles of the regular 17-ounce bottle of water. They need to consume at least 6 to 8. So they need to keep those 6 to 8 bottles at their bedside, and they have to finish that within 24 hours. If you can do more than that, that's fine. But at least that should be your daily consumption of water while you are getting chemotherapy. Now, if you have other medical problems like leg swellings or kidney problems or heart problems, then discuss it with your doctor that what is the right amount of water intake that you should be taking. Then the next trick I want to share with you is that if you have nausea or you have an episode of vomiting, try to give yourself a little break. And if you have thrown up, then don't try to force yourself to eat right away. Give your body a little break of at least 30 to 40 minutes. Let it settle down, let it pass, and then try again. And like start with the liquids or jello, something soft, and then slowly escalate your diet. And in that way, hopefully you will be able to tolerate it better. Then the next tip I want to discuss with you is be upright and walk a little bit after eating food, or even if you have to sit, make sure that you are in a upright position. By laying flat, you can have the regurgitation of all the food contents, and that can in itself can trigger nausea and vomiting. So after eating a meal, make sure that you take a little walk, and if you're not walking, then at least you are sitting upright. Now the next very important thing that I want to discuss with you, what are those signs and symptoms when you should be calling your doctor? The number one is that if you have not been able to eat or drink anything for extended period of time, and if you are not even able to take your medicines, because if you are not able to eat or drink for extended period of time, then the dehydration gonna set in, and then you're gonna get caught up in a vicious cycle where there's a good chance that the oral medication might not work very well, and you may need IV medicines. And that's what I tell my patients is that you try at home your medicines and other tips and tricks that you can do to minimize your nausea and vomiting. But if nothing is working, then call us. I bring my patients into the clinic and I give them IV medicines. So in that way you are able to break the cycle of nausea and vomiting. Another reason to call your doctor is when you develop dizziness. So if you are having dizzy spells, especially if you feel dizzy when you suddenly stand up, or if you are laying down and you stand up and you feel dizzy, that is a red flag, meaning that you are now very dehydrated. Therefore, you need to call your doctor, because at this point you not only need the IV nausea medicines, you also need IV fluids to correct your dehydration. The next tip I want to give it to you is that monitor your vital signs, at least the pulse and the blood pressure. You can buy a blood pressure cuff from any pharmacy. You can also get an oxygen monitor from the pharmacies. You don't need any prescriptions for those. If you have any lung condition or heart condition and your oxygen has been a problem, then you should have an oxygen monitor and a blood pressure monitor. And most of the time those blood pressure monitors and oxygen monitors will also give you your pulse rate. Now, if you are experiencing low blood pressure, everybody should know what's their usual blood pressure range is, and the doctors can tell you if you ask them what is the optimal range of blood pressure. And if your blood pressure is running low, that is another sign of dehydration, meaning you might benefit from IV fluid. So in these situations you need to call your doctor and notify him that your blood pressure is low. Similarly, if your pulse is too high, then that can also be a sign of dehydration. So you need to know what your pulse is at the resting position, not when you are walking around or running around, because guess what, your pulse is going to be high at that time. But while you are completely relaxed, what your pulse is. And if your pulse is higher than your regular numbers, then you need to call your doctor, because with the nausea and vomiting and high pulse, it's a sign of severe dehydration. And the last thing when you really want to be calling your doctor is that when you are experiencing severe fatigue and generalized weakness, because it means that now you are unable to eat, your nausea and vomiting is bad, you are dehydrated, so you need a medical attention. So unusual generalized fatigue or weakness is another sign when you want to call your doctor. So that's all I have on the tips and tricks that you can use to manage the nausea and vomiting, and what are the red flags that you should be looking out, and when to call your doctor in the setting of a bad nausea and vomiting. And I would like to hear from you. Give me your feedback. You can also ask me questions. Send your questions to our email ask@onlineoncology.com, and I would love to answer all your questions. I will see you soon with another video. Thank you very much.